Welcome, everyone. We're glad so many of you could join us today. Wanted to just say a little bit about what we're doing today. So this is one of our In the Pursuit of Happiness Smart Love webinars. It's a series we do, and we basically put these webinars on as a free parent resource in the community. And we use our own clinical staff for expertise, as well as experts in the field who we'll be hearing from today as well, and also draw upon the Smart Love parenting approach and philosophy that we use when we're helping parents support their children. So wanted to share a little bit more about today's webinar. Get to the next slide here. Here we go. So today's webinar is called Gender Identity, How Parents Can Help. My name is Dr. Beatrice, and I'm the clinical director at Smart Love Family Services, where we provide counseling services, assessment, therapeutic tutoring, multicultural services, as well as early childhood education through our Smart Love Preschool. And I'd like to introduce you to our very special guest experts today, Janae Joyce Ward, who is a social worker in the Gender Development Program at Lurie's, as well as Paige Ryan, who is a psychiatric social worker, and also works on the gender development team at Lurie's. So as you can see, we have, I think, we're going to be in really good hands today, getting a lot of really helpful information on this important topic. So before I hand it over to our guest speakers, I wanted to just share, take a moment to share why we wanted to provide a webinar on this topic on gender identity. The topic of gender diversity and gender development is new to many parents, people in general, and parents. So oftentimes we hear about diversity and we think about racial or ethnic diversity, whereas we don't hear as much about gender diversity. And so, you know, just even in my graduate training, which was many years ago, even as a child psychologist, we didn't talk much about gender diversity or gender development. So for many parents, this can feel confusing, right? For some parents, it can feel comfortable, but we do have many parents that come to the clinic if their child is exploring gender identity or coming out as non-binary or transgender, and you will learn about these terms more from Janae and Paige. Parents can feel a mix of emotions. Some parents can feel comfortable and positive about it and embrace it. Some parents can feel uncomfortable, confused, scared, you know, if a child is not fitting kind of a stereotypical traditional gender binary norm, it can make a parent worried for them. Will they be teased? Will they be bullied? And also just confused. And so one of the reasons we wanted to have experts like Janae and Paige today is to really start with just education, right? Getting information to help us understand what does this all mean and why is it important for children? And so before we get into the content, I think there's a concept that we use in Smart Love parenting approach that can be helpful for you, if also parents and professionals out there who are watching this. And it's the idea that as caregivers, we have both personal desires, right, as unique human beings ourselves, but that we also have parenting or therapeutic aims where we're trying to respond to a child or client's needs, what's going to be best for them developmentally, how do we respond in a way that supports their self-worth, their sense of value, their ability to take care of themselves. And that's separate from our own kind of personal desires and feelings, right? So if we have, for example, biologically male, a boy, biologically male gender child, who says, you know, I want to wear dresses and I want to wear dresses, you know, out in public and express more, you know, kind of stereotypically feminine traits, a parent may feel negative feelings about that, right? Or feel fear about that. And so it's helping us then be able to kind of put that aside to then listen to, you know, Janae and Paige's kind of ideas about information about what can help you respond to your child in a way that supports them, supports their development in an optimal way. And so this is one way for us to help take care of parents, which is to get the support to be able to do that, right? Learn the information and then get help with kind of, you know, digesting your own personal feelings and reactions to then protect the child from that and being able to come from these parenting aims. So Janae and Paige are going to give a lot of information. It's not specific advice, for your child or telling you what to do, but is really here as education and as a resource. I also want to let you know we are recording it and they have given us permission to put this on our website. So you will be able to view it again if you like, or tell other friends and families about it. And we are going to be taking questions in the chat. We may not be able to answer all of them as they come through, but we are going to save at least 10 or 15 minutes at the end to take your questions. Okay, we do want to hear from you and be able to respond to what people need. So, okay, so without further ado, Janae and Paige.
Hey, thank you. Thank you, Carla.
Yes.
Hello, everyone. We're super excited to be here with you, and we can proceed with the next slide. So we thought it was really important to just kind of review a little bit about terminology. So we know part of it is because there are a lot of terms that are out there, and we want to make sure that we express that they're ever evolving. So what we share today may be different than what you've heard, or you may hear more after the presentation at some point, but we thought it was important so that when your young person is using these terms with you, or you're seeing these terms, that there's a knowledge about what they mean. So if you want to share those, Carla, that would be great. So we refer to kind of sex assigned at birth or designated at birth as what is announced when a baby is born. Baby comes out and it's like, oh, it's a girl, it's a boy. That's kind of sex assigned at birth. And then gender identity is something completely separate, which is kind of like your personal sense of yourself as a person, man, woman, non-binary person, however you might describe who you are. And those things are separate, and sometimes they line up. Carla, if you want to.
Okay, so
yes. And so kind of that is showing you really just kind of the spectrum of how folks can identify. There's kind of an endless spectrum of how folks might do that. And then Carla, if you go to the next slide. So gender expression, again, kind of how is your gender communicated to other people? So through your name, through your gender pronouns, maybe through how you are dressing. So more an external expression, kind of how you hold your body and how you might use mannerisms and gestures, how that's kind of communicated. Go ahead. So some terms that you might hear when you hear the word cisgender is an alignment of the sex assigned at birth and how you identify your gender. So I would identify as a cisgender female. I was female assigned at birth, and I also identify as a female. Whereas transgender, there's a difference. So your sex assigned at birth differs from how you would describe your gender. And then Carla, if there are other terms, you can go ahead and
put them up. Okay.
So as you can see, it's a limited list. We had to limit it, which is difficult because there's unlimited possibilities. So, cisgender and transgender are the more binary ends of it. Non-binary gender could be described in a lot of different ways, depending on the non-binary person you're talking to. So really non-binary means neither end of the gender binary. Agender for some folks means that they just don't identify as any gender. But again, these are very personal terms that everyone is going to define differently. An important thing to remember when you're hearing it from clients or from kids is that trans or transgender is an adjective. So it's not a noun or a verb. So you wouldn't say that someone is a transgender or that they are transgendered. The correct use is a transgender person. It's another way, one way that someone might describe themselves. And then we like this visual because we think it gives a good example of the many different terms that might stem from transgender. And again, we probably can't say enough that these terms are very personal. So you might hear gender queer, again, non-binary, gender expansive, third gender, agender, trans feminine, and these are just some of the examples of how someone might describe themselves. And Paige, please jump in. I know there were some additional thoughts you had on some of the terms.
Yeah, just, sometimes people, the only kind of thing I have to add is that sometimes people will combine terms like a gender fluid girl, or identify as like a non-binary boy, or like a trans masculine non-binary person. So I just wanted to kind of note that people, kind of describe themselves in more detailed ways by combining terms.
Yeah.
So there's more diversity within diversity.
Yes,
Okay.
exactly.
Okay.
That's a good way of putting it. Okay. So something we also want to highlight, and Carly, you can add the other info to the slide, is just, again, under terms, point out that there's a difference between sexual orientation and gender identity. And so knowing one doesn't necessarily determine the other. So sexual orientation, or your sexuality, is kind of who you are attracted to, whereas your gender identity is who you are. And so those things are separate, though we know sometimes they can mesh together in different ways depending on how the person identifies. And again, that little rainbow blob we like, not only because it's colorful, but because it kind of shows that it's not linear. It's very fluid, and it can change.
Really kind of gets at the complexity, right? As opposed to kind of black or white, or just the varying shades of gray per se, right? In terms of complexity around it.
Yeah, precisely.
Okay. This is
So we like this. This is one of many kind of visual expressions that you might see to talk about sex assigned at birth and gender identity and sexual orientation. This is our little gender unicorn. And we really like this because I think it shows that everything is kind of on a spectrum, and breaks down a little bit of what's what. So your gender identity, meaning kind of like your thoughts and how you consider yourself, physical attraction as well as emotional attraction, which can all differ and not necessarily align in a way that we might think is typical. Paige, I don't know if there was more that.
Yeah. Just speaking to that, kind of my note was that, I'll get questions from parents about like, let's say someone assigned male at birth, who identifies as a girl, like, her being attracted to girls. So like, why would, my daughter transition? Like if she's attracted to girls, like, wouldn't it just be easier to, be a cisgender boy who's attracted to girls? And so really, kind of thinking about the distinction and the difference between like, gender identity and sexual orientation, that just kind of speaks to that.
And can you speak to, just in terms of how this can be helpful for parents, like just even understanding like this, kind of gender unicorn, all these different aspects of identity, kind of what can be helpful about that for parents from your experience?
Yeah, I mean, thinking about like the ways, like Janae used the word, I think like alignment, like misaligned, or, kind of what our expectations of a young person, kind of what we're seeing is like congruence, right? I think kind of understanding these identities or experiences like distinct categories, and that one doesn't inform the other, like sex assigned at birth does not equal or is not, kind of congruent with gender identity or sexual orientation. Like one doesn't have to inform the other. And so kind of thinking about it that way, can help parents not make assumptions.
Yeah, not make assumptions. That's what I was just thinking, right? Kind of more of an openness, to all the different possibilities.
Yeah, definitely.
Thank you. Okay, you ready, Janae? Okay.
The next slide. So this is kind of, I added this in. This is the way that I often talk about gender, like my conceptualization of gender. I just find that it's helpful to kind of have a couple of more categories. So I added it. So there's gender identity, as we already talked about, personal sense of self as a man, woman, or another gender. And then physical body, the degree to which the body is feminized, masculinized, or androgynous. So, sometimes I find this is helpful to include it for some young people. Their physical body is a part of how they experience their gender, maybe not identify, but given that other people will use like the gendered aspects of a person's body as physical markers or cues to like how they might gender that person, if that makes sense. So I include that in there. And like I said, it's not like a person's physical body isn't always a part of how they understand or like what they want for their gender transition, but sometimes it's a part of that. So, and then gender expression, we already talked about. And then the other I add in is like the social experience of gender. So kind of more so interactions with others. And like I said, how they're being, kind of gendered by others. They can kind of, and I separate them because they can be distinct experiences for someone. And it kind of just gives a richness to like the conversations that we can facilitate and that parents can have with their kids. So, and I think also it's helpful when kind of having discussions with like non-binary young people, especially. So, I'll get the question, like, if my child is, non-binary, like, why are they considering, kind of medical interventions at all? And so, there can be benefit in thinking about how the physical body and kind of those gendered aspects of a person's body impacts, a person's experience of their gender, or how they move through the world in a social world, if that makes sense. But let's see, is there anything else that I wanted to add? I think, speaking back to like assumptions or expectations, people, just not just parents, but can have the expectation that like their child will have a stereotypical presentation of their affirmed gender. And so what is being perceived as, like we said, like misalignment or incongruence amongst like these various dimensions of gender can then lead to like confusion or questioning, like invalidating that young person, or like, well, if you are a boy and you want us to use he him pronouns, like why do you sometimes wear kind of traditionally feminine clothing still, or and so kind of not seeing the difference in like gender expression and like clothing that we choose to wear and like the person's identity, if that makes sense. So
Well, it sounds like a continuation of just the value of being able to understand your child's unique expression of who they are, right? So it's not fitting in any kind of rigid category. And I think, like you were saying, Paige, right, there's these kind of stereotypical ways that we can think about gender, right, that can be very, very socialized and very ingrained. So I think, it sounds like you're saying that when there's maybe like one way that it's congruent or fits the stereotype, and then another way where it's not, that parents can feel maybe very confused by that or doesn't make sense to them. But it sounds like you're saying that the important thing is really trying to understand, again, that there's a diversity, right, that we're all unique human beings, and the diversity within a child's experience of their gender and expression of it. And it's valuable for the parent to try to understand the child's experience and affirm it in that way.
Exactly.
And I think you're going to talk about the benefits of that, right? Are we going to get to that? Okay. Should I go on to the next slide?
Yes. Yeah, go ahead.
Okay.
We'll talk
okay.
about some,
okay.
Yeah, we'll hit on some parent supports. The next slide, kind of goes along with some of the ways that someone might experience or acknowledge their gender. It's pretty simple, but can make a big impact when we talk about pronouns. So, it's okay to ask what pronouns people use, whether it's she, her, he, him, or they, them, or a whole list of other pronouns that folks might use to describe themselves. And it's how we refer to ourselves or want others to refer to us when not using our names. We in the field hope that it becomes very normalized at some point to introduce yourself with your pronouns as seamlessly as you do your name. And one place we've started to kind of see this unfold, which is great, is in the classroom. Teachers are now asking even, students as young as middle school, when they introduce themselves on the first day of school, for their name and what are their pronouns, and making it very normal to find out that information. And also in medical settings. So we're encouraging, primary care providers are starting to get on board with making it very normal. I'm Dr. So-and-so, I use these pronouns. What's your name? What pronouns do you use? And then kind of continuing with the visit. So the hope is that it moves into not being this entirely separate kind of taboo, out of the box thing, to just being like, this is part of how
Like your name
we
almost.
introduce ourselves. Exactly. Yeah. Because it can be very linked. So if you go to the next slide,
Okay.
it's going to happen that your client, your young person, your
please.
child is going to is going to ask for a different name or a different different set of pronouns, and we're going to make mistakes because we're humans. We do it, parents do it, professionals do it, and there's a pretty quick kind of 4-step resolution when that happens. So you're going to apologize, you're going to correct yourself, and you're going to move on, and then you're going to practice. So, if I misgendered Paige, I would say, oh my gosh, I'm so sorry. I know you use she, they pronouns. I'm going to do better moving forward. And then I do practice, by myself, moving on from the conversation. So it's really, really important to not belabor it. Oh my gosh, I'm so sorry. It's just, I knew you this, and I knew you with these pronouns and this name, and it's just been so long. And, this was such an abrupt change. And I'm only now finding out. That only leaves the person, it puts it on them, the discomfort on them, when we kind of linger on the fact that we've made a mistake. So again, mistakes are going to happen. You're going to apologize, correct yourself, you're going to move on, and then you're going to practice. And again, mistakes are going to be made.
I've heard the kind of experience for some people that it can feel like then it's like a burden for others, right? When, to kind of make a big thing of it or overly apologize, it can feel like it's then a burden for other people.
Yeah. And something we've heard is helpful, and that other parents have actually shared with us that is helpful, is to practice, it's muscle memory. So talk to yourself about your child using their, their preferred name or their pronouns, and to do that, and to correct yourself when talking to yourself, and to try to remain consistent in using your child's name and pronouns, even when they're not around. So, it's one thing to really kind of center yourself and be able to kind of to do it when you're in the presence of the young person. It's equally important to practice when you are not with the young person as well.
How do you help parents, like just in your experience, like when a parent has a lot of anxiety about using a pronoun, that if they're having some discomfort with it or worry about what that means? And do you have any just like pointers in terms of kind of how to help parents understand the value of using the child's preferred pronouns?
Yeah, I mean, the value being like the support, right? And you're, kind of honoring like your young person's identity and kind of what feels affirming and, supportive to them. And then also, kind of the thought of like, I need to be perfect. And if, I make a mistake, like that's not going to be okay. So, I've had some parents say like, I just have put off, starting to use those pronouns or trying or practicing because that feels scary. Or like if I make a mistake, my child is going to be mad at me. And so I just avoid using pronouns altogether, that sort of, and the young people often like notice that and you kind of make note of that. And that can feel like challenging for them as well. One thing that I've, kind of sometimes asked parents to do, if like for parents who are, or family members who are having a more difficult time, like at home, I mean, at school and at work, sometimes people will wear like pronoun pins. So wearing those at home sometimes, or at home wearing like something that says your name on it, if like there's, challenge with the name. And it might only be for a short period of time, but then like that's kind of strengthening, like it's a visual cue that strengthens the association between like the affirmed name, the new name, and the young person. So just kind of seeing it and when they're wearing it and while you're interacting with them can be helpful.
And we'll touch on it a little bit because I know it can come up for parents that, well, if I use this new name or, I use this new pronoun, that's really kind of opening the door and, the fate has been sealed for the young person and their gender identity and how they'll continue to develop. And there's no research that our team has, come across that says if you use the name and pronouns or you affirm your young person that's it, that you're pushing them in one direction or another. Pronouns are very reversible. So, and names, you meet your young person where they're at. And like Paige is saying, practice and use them because it's important. And then if they go back to what it was before, then, you go back with them. There's nothing permanent being done with name and pronouns. It's very reversible.
It's all part of exploration, identity exploration. And I think to make the point, right, that if parents do the opposite and don't affirm, it can oftentimes create an opposite effect of then somebody even clinging on to something for that very purpose that doesn't necessarily allow them to kind of do their own exploration about themselves, kind of, so it can even have an opposite effect, I think. The parent being, negative about it or not accepting.
And I mean, young people using, adopting or using a new name, new pronouns. Sometimes people will, a young person will like start out at home where they feel safest and where there won't be, kind of repercussions of exploring, like you said, kind of like trialing use of a new name or new pronouns. And so sometimes they'll do that at home, or sometimes they'll do that with like a group of friends. And they gain insight from that, like, kind of how does it feel to use this name? How does it feel to use those pronouns? And like your child is learning about, what feels right and what doesn't feel right. And, also to speak to that, like sometimes I've had young people use pronouns that then don't feel good, don't feel affirming. And so then they'll, change to other pronouns and trial those, and those, might feel perfect for that time. So, I mean, they are kind of learning about themselves, and having that like space to explore and gain that insight is super helpful.
Sounds very dynamic and developmental. Yeah. Paige, there is a question that came in that was actually directly about your pronouns. So is that okay if I ask that real quick?
Yeah.
It says, hi, Paige. I've not seen the pronouns like she, they, as you have displayed, and how do I interpret that, or how do you interpret that?
Yeah. So sometimes, people will use a mix of pronouns. And so sometimes also people will, that feel reflective. They'll use a mix of pronouns that feel affirming or reflective of their identity. So sometimes it won't be just she, her, or he, him, or they, them. People can mix those pronouns, and also sometimes order matters. So like if someone feels like most affirmed by they, but also feels affirmed by he, they might put they, he pronouns. Or, if they feel most affirmed by he, him, but they, them also feels, reflective of them, they might, put he, they pronouns, if that makes sense. So, so there's diversity in that.
Great, thank you for sharing that. Okay, do you want me to go on to the next slide?
Yeah, I think we wanted to touch a little bit on just the impact of affirming language. So a little bit of a continuation from the previous slide. And Paige, I know you've had this come up with families that you've worked with, so I'll.
Yeah. So, and sometimes like really the impact I'm hearing about is coming from the young people, like, kind of noticing how the way that information about their identity in them and about them is communicated, can feel affirming or not affirming. So I put some examples. So like a parent saying like, my child is a girl, versus like my child identifies as a girl versus like my child believes she is a girl or thinks she is a girl. Kind of the saying that your child, believes that she's a girl kind of implies that there's a difference between like who she is and how she identifies, if that makes sense. And so that can feel invalidating to some people, to not say like she is a girl. Kind of once, as someone's transitioning or after kind of they've socially transitioned, to still kind of think about it in that way, like that their experience is different than kind of like who they inherently are, if that makes sense. Also, like my child's pronouns are they, them, and the distinction with my child's preferred pronouns are they, them. And then below, like my child's preferred name is John, or my child's name is John. So the use of like the word preferred has kind of fallen out of favor. It's like you can say like affirmed pronouns if there is a distinction, needing to be made, more so like in the name, like if it's at a doctor's office or something where they, might have like the legal name on file rather than like the affirmed name. But again, just speaking to like the difference between who they are and like the name that they, and what pronouns they use, or saying that there's, I guess, implying that there's a choice, like when we say preferred pronouns or preferred name, that, kind of communicating that to someone else, then, kind of implies that they don't have to use that name, but, it would be nice if they did, if that makes sense.
So you're saying it's better to say affirm. What's the word you suggest then?
So you like, if you have to make the distinction, you can say like their affirmed name is
Affirmed
John.
name. Okay.
Otherwise, just saying like my child's
Their
name
name
John.
is, yeah, gotcha. Okay, gotcha. Yeah, I can hear that about the preferred, like somehow it's kind of optional. Can you please, rather than this is what it is. Yeah, okay. Thank you for that.
Yeah.
Next slide, or Paige, were you going to say something?
No, I was looking, you can go to the next slide.
Okay.
So we know, we're not going to get too far into the weeds of, kind of any of the science of gender identity, not because it's not important, but because we wanted to kind of make sure that we talked to what feels most important for young people and for the folks on the training. But we did feel like it was important to at least talk a little bit about the development, because that is a foundation for what the young person might be experiencing. And so Paige is going to take it away with the next slide.
So and then Paige, there's another question that came through that I think might relate to this. So why don't you maybe do kind of the overview, and then I can read the question.
Okay. So yeah, when we think about gender development, kind of at 18 to 24 months, a child is usually able to like label gender, boy, girl. It's most often boy or girl at that age. And then 2 to 4 years, they gain the ability to like recognize gender differences, and that different people might use different pronouns, even if they might not understand why. And often like the gender differences recognized are still simplified, like, everybody who has short hair is a boy, or everybody who has long hair is a girl. And then, 5 to 6 years old, a child can declare a gender identity, or that's kind of when we see that ability or that kind of distinction being made. And so, we always talk about like gender exploration is a natural kind of normal part of gender development. Children can experiment with like through play, clothing that they want to wear, like through play, and then clothing that they want to wear, kind of elsewhere in everyday life. And then also like peer affiliation. Who are they relating to? Like who are they choosing to be friends with? What do they like to do with those friends? That sort of thing. You can go to the next slide. And then Jane, I think you're going to speak to this.
Oh, sure.
Mhm.
So to kind of build on that and what a young person might move through those stages of development is just thinking about a gender expansion or some gender creativity. So previously kind of described as gender non-conforming, which is a word I think that we're trying to move away from, just because non-conforming to who, and who gets to conform, the ideas that we've adopted. So I think we prefer just kind of like an expansion or creativity on how you're identifying. So again, we've touched on it a little bit, but your outward expectation, your expression and behaviors not necessarily matching the norms or stereotypes of your sex assigned at birth. We look at kind of if there's been a long standing occurrence. So, taking into consideration kind of how long this has been going on, not like a curiosity or an interest, and not because curiosity or interests are any less valid, but more so just kind of examining or looking at or taking into consideration how long a young person has been exploring this. It's a totally normal like variation of human diversity. So gender expansiveness or gender creativity is just another way and more terms for young people and adults, for all people, to experience their gender. I think within the last several years, and we're all thankful for this, that there's been more representation of trans and non-binary young people kind of in the media, in Hollywood, and more kind of big name ways, especially social media in a lot of ways has created a platform for people to share their gender experiences. But it's not new, and it's not limited to any particular culture or ethnicity or area of the world. It is seen throughout history, and it is seen across cultures. So this is, I think sometimes it's newer to those of us who grew up in a time when it was less present or less kind of publicly
Discussed.
present,
Yeah.
and
Yeah.
in a time where you were really only experiencing a couple of different genders, and the assumptions were made, but this isn't new. This isn't a trend. This isn't like something that kind of came out of nowhere. But I do think, again, there's been progression in representation, which is, we hope that only continues. So
it really speaks to the right kind of the fight, fighting against and, like you said, progressive around not making people feel ashamed for who they are, and there being more of an openness and challenging of that, right? Of those really rigid, again, even things like homophobia and all that, what affects kind of the LGBTQ community, right? Like they're just being a lot more, I think, challenging of that and more openness. So like you said, what's already there just can come out maybe more safely and openly because there's more support, acknowledgement. So yeah.
Exactly.
So can I ask this question? I think this question in some ways relates to this. Is that okay if we take a pause and take this question?
Yeah.
So this person said, I love, accept, and support my kid, and I'm going with the flow as they are going through their identity formation process, knowing that how things feel now may change over time with maturity and lived experience. But I can't help but think a lot about how this seems to reinforce gender stereotypes, that boys are now allowed to be feminine, and therefore, if they feel feminine, then they must actually be a trans or non-binary person. Can't we allow a broader understanding of what it means to be male or female rather than rejecting it because it doesn't fit some sort of male or female ideal?
Yeah. Yeah. So, I mean, we live in a social world, right? And, I don't know if you all have heard like the phrase, like gender is a construct or gender is a social construct, like definitely. And, when we have young people who come to us, we don't make that assumption. And sometimes we try and challenge like that assumption of like, well, I like, example, I, like ballet, or like, I want to be a ballet dancer. And so like everyone in my class is a girl. And so I must be a girl, like things like that. Like we push against that. And usually through discussion. It depends on, kind of age of the young person, kind of how those discussions or that exploration goes. But we do kind of, push back against that. But it's a dance between, kind of not invalidating the young person, and then also like get in, age appropriately, like getting them or allowing them, helping them to like think about aspects of gender, like in a broader way, or
Broader, fluid.
Yeah, and I think a way, one way that those discussions can start is by asking the young person, and something we ask, not only from the beginning stages of when I do the phone intakes, or when we see a young person in person, is how did you come to know your gender? Where, how did you come to learn this about yourself? Which I think, like Paige is saying, sometimes does open the conversation, especially with younger people, of like, well, I like ballet and I'm in a ballet class and there's only other girls in this, as far as we know, only other girl identifying folks in this class. And so, it's an obvious conclusion. And I think, like Paige is saying, that we open those discussions and we don't, ignore where that is coming from and assume that we know a young person's gender, what the outcome is going to be, but instead kind of ask them, like, how did you come to understand this about yourself? And, for the person who asked the question, like, I think we would all agree that we'd prefer a society that just allows young people to identify however they're going to and keep their interests, and not feel like they have to conform. Yes, absolutely. I think we all would love to move towards that. And as we work towards that, like Paige said, it's also a dance to support where the young person is, because society doesn't seem to be getting there as fast as we would like. And so continuing to let the young person explore, which it sounds like you are. But yeah, like Paige said, gender is a construct. We've gone and constructed it in society, and it is
hard to deconstruct.
Yeah.
Yeah. Yeah.
Okay.
That's really helpful. Okay, you ready for the next slide?
Yeah.
Okay.
So, this image kind of shows or speaks to like young children who, kind of present with gender expansive behavior, or, have some gender expansive presentation in some way. This kind of speaks to, not only the timeline or kind of the stages, but also the potential outcomes. So a lot of times, understandably, parents will experience a lot of anxiety about like, what does this mean? Or what is this going to mean for my child's future? How are they always going to identify this way? Kind of all of that. And so this just shows like kids who, before puberty, it looks like, if you can look on the timeline, children who experience gender expansive behavior, like may go on to identify as trans adults or adolescents, may go on to identify as like gender queer youth in some way, may go on to identify as cisgender, but then kind of sexual orientation might not be heterosexual, or they might kind of go on to be a cisgender heterosexual person. So they're, as we said, like gender exploration is a natural part of childhood. Like, there are many outcomes, kind of that the young person can have. But the important thing is that we, like I said, we said, allow space for like that exploration and that person's identity formation, and, gaining insight about themselves and what feels affirming. And that can change at different times. But.
And so,
go ahead, Janine.
Oh no, I was just, yeah, if you don't have anything to add, Carla, I was just going to say we can move on to the next slide. And this kind of what Paige was saying melts, kind of nicely into oh, sorry, yeah, sorry,
Yeah,
did you advance to the next slide?
Yeah, I can. Yep, this is
okay.
So it just shows, I have the little timeline at the bottom, but this speaks to like gender development occurring at puberty and later. That's a lot of questions that we get, or a lot of challenges that parents present with, like, why didn't my child kind of know earlier? Why is my teen now only now telling us that they're trans? Kind of where did this come from? And so it's helpful to kind of think about this timeline and kind of what happens or what a child is experiencing. So like before puberty, prepubertal bodies are more similar than not, especially when considering kind of what can be perceived by others, like in general around them, when they're wearing clothing, like, kids can look the same. And then, at puberty, a lot happens. So, kind of body changes, including like the gendered aspects of a person's body that we kind of talked about a little bit before, which others use as like visual markers to gender a person, social roles and expectations or limits. So new expectations of that person regarding their body, expectations that they cover up their body or show their body, like grooming expectations, grooming behaviors that are expected, what's considered to be attractive, and then also like limitations that now are here and that someone didn't experience before, like feeling unwelcome in certain peer groups or like by peers of a certain gender, if that makes sense. Like I always, someone will say like, I always played with boys growing up, someone assigned female at birth. I always played with boys growing up. And then now like, it's suddenly not okay, or like, I'm not welcome, to kind of play with them or be their friend or that sort of thing. And so, kind of a lot of insight can come from that. And then brain development, allowing for more understanding of abstract, complex, and nuanced concepts and experiences of gender. So all of those things kind of happening at that time is kind of what like our understanding of why young people can kind of come to their identity or form. The identity formation is kind of continuing at that age and beyond, if that makes sense. Like,
well into your 20s, really. I mean,
right.
And then any time in your life, but I mean, right, even adolescence, they really see us through your 20s. So yeah. I'm wondering, we only have about 10 minutes left. So I'm wondering, can we get to some of the data you have about the value of parental support and maybe just say a little bit about that? And then, there's another question that came in that I'll look at, but I want to just, okay, here we go. Is this one of them? Yeah.
Yeah.
Okay.
Yeah. So if you go, exactly. Yeah. So we know with all of this and all that we've talked about is the young person experiencing this, probably primarily, but that as parents, we experience everything, and as providers, we experience everything. The young person is feeling right along with them. So we do recognize that there is a huge supportive role of the parent or the caregiver. And so, we did want to touch on just a couple of things that we consider when working with parents of young folks who have just come out. There's a whole resource slide at the end of this that have the books listed on them that are on the side of the slide there. But, steps that parents or caregivers can take. So, we would consider like, thanking your child for coming to tell you and, expressing this gender exploration or, a different name or a different pronoun, because they communicated this because they trust you and they trust you to be supportive and affirming. And that's a big deal as a parent and as a young person. As far as kind of like, we get the question of like, well, what do I do next? And it's like, talk to your child, follow their lead, like provide some space for the child to describe their individual experience or ask them what kind of support they need. Is there a different name? Are there different pronouns? Sometimes it's just enough for young people to come to their families or their close friends and kind of to disclose this. And then they kind of sit in that stage for a while. Carla, if you go on to the next slide, it's continued. And other supportive roles or things that are important to think about is kind of accepting some of this unpredictability or the ambiguity of a child's gender journey. They may not have it all figured out right now, and that's okay. That doesn't mean that their experience, as a gender fluid person or gender expansive is any less valid just because they don't have it all figured out about what they want to do next. it's okay. Again, taken in stages. Sometimes it's just enough to come out to the people that you know care about you, and to kind of to rest there for a little bit. And I think most importantly, we do recognize that this is a process for everyone. Parents and providers and caregivers are not immune to the experiences of their young people, and they deserve a space, and they are more than entitled to and fair to have their own emotional responses. I think the distinction that we encourage folks to make is having that emotional response and where is most appropriate. So, you know, kind of forward facing to your child, it's difficult, it's a challenge, but it's asking parents to kind of present in one way, even if that kind of goes against how you're feeling emotionally and your own responses, and then connect with folks as a parent. So, you know, we recommend like caregivers are going to connect with other caregivers of trans or non-binary young people. There are a number of different parent groups, and we can send those supports if they're not included. And also seeking individual like therapeutic support for yourself as a caregiver can be huge. It allows you to have that space to process again what you're going through.
Yeah, that's so important.
Without doing that in front of your child, because that isn't an appropriate space. Your child isn't an appropriate person to process the feelings that you're having, or the doubt, or the questions, or the fear, which we know a lot of it is stemmed in fear for our young people. Continuing to provide a space in the home for them to explore this is hugely important. Again, they came to you as their parent, they trusted you, you know, they must feel like the home is a supportive and affirming place to be able to take that first step.
Yeah, I really appreciate you sharing that. And also, right, the idea that parents do need support too, right? So it's not about them not having their feelings or getting help for their feelings, right? And that there's resources out there, including us at Smart Love and you at Lurie's. So we do have a couple questions that I want to get to. I'm wondering if you can just say there's information you have about just some of the data that shows how kids do when they're supported versus not. Can you just say a few words about that? And then I want to read these two questions just so we get to them. I know.
Yeah. So if you go, I think it's the next slide.
Here, this one. Yeah.
Yeah. And there's one that, there might be one other one, which, exactly. So having like one supportive adult cuts the chance of LGBTQ plus youth being at risk of suicide by 40%. So, you know, that, and that one person doesn't necessarily have to be a parent. You know, any of the data, any of the research shows, and I think if you go maybe to the next,
okay, can I move on? I think it's somewhere.
Yeah, if you go to benefits of affirmation, so sorry folks.
Yeah, right here.
Jumping
this one, right
here. Yeah, you know that there's a number of benefits to being gender affirming. So it's allowing social transition and continued exploration. It's, you know, allowing the chosen name, using that again associated with lower rates of depression and suicidal ideation when appropriate, and after being explored, you know, any medical transition puberty blockers have also been shown to reduce a lot of the negative feelings and emotions. And again, moving through the process for transition. And there are many, and there is an appropriate time for all of them. But
there's a question, Janae, about that. Can I ask that? I think it's a good timing, and I want to get to this person's question. Let's see. So my 12-year-old is pushing very hard for puberty blockers, hormone replacement, and surgery. I support the exploration, but I don't feel the age of 12 is old enough to be making long-term life decisions. How can I support my child in their transitions while respecting my very strong feelings about the drastic changes? Really, really good question.
So
yeah, very good question. I mean,
yeah, and I would encourage, you know, that person in their family or any family of a young person around the time of puberty, you know, puberty blockers, like it's best to kind of have a consultation with a medical provider, but puberty blockers, you aren't making changes. Like it's pausing. We talk about it as like pausing puberty for a period of time. And so, you know, the child might be interested in like hormone therapy and surgery, but at this age, at 12, I think you said,
12, yeah.
kind of blocking pubertal changes while this person is, kind of becoming more confident in who they are, or, for family to kind of get some reassurance that my child is like, confident about this and is continuing to feel this way, like during the time that they would have been experiencing puberty, can be helpful, giving the child and the parents kind of breathing room, if that makes sense.
It's kind of like a process.
Right. And the blocker medication can be helpful in, kind of pausing and therefore like preventing some of those gendered aspects of our bodies from changing, which then may require, additional surgeries or more kind of intensive like medical interventions in the future, if that makes sense. So, if you're thinking about like the child going through puberty in its entirety, their endogenous puberty, a lot can happen through that. And then only thinking about ways to like counteract or, kind of change their physical body after that can be, sometimes that's the case, but there just can be benefit in, using a puberty blocker, if that makes sense. But I encourage anyone kind of navigating that decision to talk with a medical provider to get all of the information.
Yeah. So Janae and Paige, can you say a little bit about what you do at Lurie's? Because, there's another question that came in through that's more like you can really hear the parents that are dealing with, trying to really help their child. And I think have kind of more substantive questions. And just in terms of the kind of consults you provide, I just want to give this one, just read this. I don't think we're gonna be able to answer it, but maybe just in terms of we can jump to the resources page. So we get that out there because I want to make sure that's in the recording. But this person said, Lydia said, our child seemingly overnight became a different gender and within a short time walked into Howard Brown at the advice of friends and started hormones without any follow-up care or mental health support required while undergoing feminization treatment. How can parents support their older child who is seemingly unable to go to school or keep a job, but is able to start hormones that further complicate their mental health issues? Thank you. This has been the biggest struggle of our life. So, we can really hear, right? Just for parents, trying to navigate this. So we obviously can't answer that question. Maybe you can speak to it, but also can I jump to a resources page? And if you can just talk a little bit about what's available to parents in terms of consultation. Mm-hmm. These are big questions.
Yes, definitely.
Yeah.
Yeah, we have our care model on one of the slides ahead.
To this a care model, this one, or is it?
Keep going.
Is there like a here? Okay. Oh, good. Yeah.
Janae, if you want.
Yeah. So and speaking to just kind of how things are at Lurie, and there's a number of different models of care, but our team does include the medical providers, the behavioral health staff, the social work. We have a lot of conversations before a medical intervention is started. We talk about fertility, social support wise. We have groups that folks can join. You don't have to be a patient in order to come to any of that. And we do have kind of trainings for school and other organizations. It is difficult, and we recognize a complexity with parents of adults. So anyone 18 or older can, exactly like this parent is describing,
Can
access
come to
care on their own.
Okay, that's terrific to know.
Yeah.
Okay.
Yes, at 18 you can make your own medical decisions anywhere. So you can,
right. But a parent can still get support.
A parent can still get support with us. Yes, of course. And there are other groups. And again, Carla, we can send you additional things, but PTI, or Parents of Trans Individuals, which is like a subset of PFLAG, have groups specifically for parents of trans individuals. And again, Carla, I can send you some of that information to distribute a little wider. But I think parents getting support is one of the biggest things, especially in those situations, because you don't have medical control over what your young person does, which is frustrating, I have to imagine.
Yeah. Okay, that's
different programs that have different approaches, and so and for different reasons, different patients are presenting with different experiences and kind of places in their process. One thing I really did want to mention also is like sometimes a person is thinking about their gender for a long time before they share it with family or before they share it with anyone, really like exploring and figuring out on their own sometimes before they, kind of verbalize it, if that makes sense.
Mhm, mhm. Okay, is there a slide here? Well, you wanted to say a word. We have to finish up in a moment, but there's also a resource page, Janae.
Yeah,
right
I
in
think
here.
it should be,
Did I pass it? Oh, here it is.
yeah.
Okay, so if people want to take a picture of that now, they can, and then this will be up on the website in the
Yeah.
recording. So I just want to make sure to get to that.
And it's not exhaustive, and we know
Mhm.
that, and we could have had like 10 more slides like this. So again, Carla, I'm happy to send out generally
Yeah.
what we send after
Mhm.
talking with parents.
Mhm.
But we do love the website Gender Spectrum because it has a bunch of resources on there. And then again, yeah, books kind of for parents and young people, not only to work through together, but to work through separately, especially as a parent who might have questions or things that they want to process on their own. But I am just going to write down to send you maybe like
Yeah.
more local specific resources and make sure we can get those out to folks.
Okay, and then I will, so on our website, if people are interested in hearing more about what these resources are, after Janae sends them to me, people can go on our website. There's a way to contact us through the website, and I will get that email if you just put that you attended this webinar and are interested in hearing more about the resources. It will get to me. Okay, I wanted to, yes, so here it is, contact@smartlovefamily.org. You can email that. I will send you the information that Janae and Paige send. Always looking for feedback. Also just wanted to mention before we finish that we do have a webinar on college decisions, kind of shifting gears. Another right, complicated, anxiety provoking topic potentially. So people, are more than welcome to join. This is a free webinar, March 10th. So I do want to thank you both, Janae and Paige. I think, one of the main messages that you really, I feel like sent throughout this whole webinar is, children really need to feel the safety net of love and care with their parents, right? And acceptance. And it's not an easy process, right? Like these last couple of questions, it's complex and big decisions to be made, right? Especially if somebody's under the age of 18 and there's things that are physical interventions. But, one of the things that we really talk about at Smart Love is just the value of a child feeling cared about, understood, listened to, affirmed, appreciated, that the parent wants them to be happy, wants to support them, so they can have a life of inner happiness and the ability to take care of themselves, right? And I think so much of what you're sharing is about being able to do that, provide that safety net, right? Because like you were saying, some parents fear about children being teased, but if they don't feel the safety net at home, right? Feeling the safety net at home is what can let them kind of go out into the world and then be in a better place to be able to handle the potential losses with peers or society, knowing that they're loved and cared about, that they have that as an internal safety net. So I just really appreciate your expertise, sharing it with us today, all this knowledge and information. It's helping me certainly a lot as a clinical psychologist, and hopefully it helped, I'm sure, a lot of parents too. So thank you for your time and sharing.
Thank you all. We're sorry we didn't get to everything, but please, Carla, filter any questions towards us, and we're happy
to. Yeah, and we hope that we have part 2 sometime.
Yeah, we'd be happy to.
Yeah, so thank you.
Yeah, thank you for having me.
Thank you.
Yes, thank you.